naturopathic doctor. I have the pleasure of being married to a chiropractor, so I know a lot of you are chiropractors. He also has additional training in acupuncture, so I know a lot of you are acupuncturists out there. So our clinic is integrative. We also have gynecology and women's health in our clinic. So our approach is one where we definitely view nutrition as to be the foundation of everything that we do, but we incorporate all these modalities for what we find to be excellent outcomes. My background is in science. I did an undergraduate degree in nutritional biochemistry. I actually lived in the Midwest for a little while. I was at the University of Iowa. I was in a PhD program in biochemistry there, but I decided I wanted to work in a clinical setting and found out about naturopathic medicine. It was a great, perfect fit for me. Through my training, I continued to do research, and then now in a clinical setting, still very focused and specialized in biochemistry, and now genetics and precision medicine. So that brings me here to talk about epigenetics. So I do, as Dr. Trope mentioned, I do a lot of genetic testing in my practice to help me guide what would best work for patients in terms of what type of diet they would do well on. Should they be on a Mediterranean diet? Should they be on a low-fat diet? But also looking at SNPs, so these single nucleotide polymorphisms, to help further categorize where patients could be stuck. But back to the core of it, it's phytonutrients. It's always nutrition. So today I'm going to talk about how these specific phytonutrients and the quality of the food in the diet affect your genetic potential. I'm going to talk about oxidative stress and inflammation, which are basically like the two key areas that you really need to know a lot about. And then I'm going to spend a little bit of time talking about cognitive health and also about some SNPs that interact or impact your genome. So these two processes, oxidative stress and inflammation, you hear about these all the time. They're what is present in most chronic disease. So when you're looking at your patient who is here in front of you and have 5 different complaints, at the core of it, it's inflammation and oxidative stress. So inflammation essentially leads to oxidative stress and vice versa. So you need to look at both of them. Inflammatory cells release large amounts of these reactive oxygen species, and that's what's being quenched by actual antioxidants in the diet. So all these, many of the phytonutrients you're hearing about, those are antioxidants, the superfoods. They have very strong antioxidant potential. So on their own, they can quench free radicals. But what they also do, as the science has evolved around this, is that they also impact genetic expression. So now you have these endogenous pathways that are upregulated that help control the balance of inflammation and oxidative stress. Just as we know inflammation is necessary for healing, oxidation is also necessary. So oxidation is needed because the phagocytic cells use these ROS species, these reactive oxygen species, to essentially kill things and for apoptosis. So we're always talking about balance. It's when oxidative stress gets too high, inflammation gets too high and chronic, that's where you have a problem. These bioactive constituents, as I just mentioned, actually have the ability to protect the DNA. They have these direct antioxidant effects, and then they have these what I called indirect effects, and this is where it's enhancing your gene systems to upregulate the antioxidant systems that you have intracellularly. And then this also impacts enzymatic function too. So 2 big key players that you need to know about when it comes to inflammation and then oxidative stress. Inflammation, you're always going to hear a lot about NF-kappa B, and you'll hear about different phytonutrients affecting NF-kappa B. So NF-kappa B is the regulator of inflammation. You kind of think about it that way. There are other players there, but that's the key regulator of inflammation. It impacts the production of cytokines that have an inflammatory cascade. It impacts enzymatic function, and then it also impacts microRNAs. And I know we're going to talk a lot about microRNAs today as well. Antioxidants actually block NF-kappa B. So here again, this interplay between oxidation and inflammation. One thing about NF-kappa B is some of the subunits in there actually impact genetic function that can work in a way to resolve inflammation. So of course, we're humans, we're complex people to deal with, and we're also complex in a cellular level and even at the level of the nucleus in our DNA. So then the other thing you need to know about the other key player, so you've got NF-kappa B for inflammation, and then you have NRF2. NRF2, NRF2, is a transcription factor promoter, and this one is at play in oxidation. So this is a regulator for the antioxidant system. It's also really important in detoxification pathways as well. So as you can see, many of these phytochemicals in your diet impact NRF2. So when you look at some of these really detailed scientific studies and papers, you're going to see things like curcumin affecting NRF2 pathway. You'll find many papers on quercetin, on resveratrol, EGCG from green tea that impacts the NRF2 pathway. And this is where you're getting the genetic upregulation of the antioxidant systems and detoxification. That's very key in keeping these systems in balance. And it all goes back to the diet. So when we look at even in the beet leaves, you can see that the phenolics in there are the key regulators of antioxidant activity. So depending on what part of the plant you're looking at, the amount of phenolic activity in there is going to impact the free radical scavenging, and it also upregulates the antioxidants pathways. Already saw this today, the big problem with everything, so you're hearing that vegetables, nutrients in our diet, all these plant compounds are really critical for keeping oxidative stress, oxidation and inflammation in check and keeping it in balance, but most people in the United States are not eating enough of those foods. So that is why you're seeing chronic disease at the level that we see it. And you also already heard that only one serving of food of vegetables matter. And many of your patients, I can do dietary recalls on patients, and they come in, they're not eating any vegetables in a day. Or if they did eat a vegetable, it was a baked potato, maybe, or it was French fries and ketchup. And the USDA does categorize French fries and ketchup on the vegetable intake in the United States. So if you can just start to introduce basic nutrition and talk to people, and some of the doctors in my clinic laugh because I say, just like try to get them to eat a vegetable. Like you should just talk to them about eating a vegetable today. And it's really difficult because you have kids that are picky eaters. They haven't been, and they've been left to their own devices of being able to control what is put on their plate, and they get away with it. And I'm a mom of 3, and I obviously had training and knew the importance of nutrition, but even small amounts matter. So when I'm talking to a family and we're talking about introducing phytonutrients and vegetables to kids, we start by just even reducing their snack to like half of that serving of goldfish and eat some carrots with that. And give them the carrots first or cucumbers first, and then they can have their half serving of goldfish. So you're just starting to introduce some nutrition and phytonutrients into the diet. And certainly it's not as dismal for everybody as that, but you do get cases where you're working with kids who the parents are like, can't get them to eat any vegetables or fruit. And here's a slide looking at the amount of fruit consumed on a given day, kids aged 2 to 19. So you can see that when we look at this fruit chart, what's also present on here is fruit juice. So when you look into those guidelines, you see fruit juice, and here you got your 2 to 5-year-olds drinking fruit juice, and then they stop drinking it, which fruit juice isn't ideal, but they stop drinking it because what do you think is happening? What do they start drinking when they get older? Soda, yeah. So not many kids eating berries, melons, and I'm going to talk about why that is so critical for cognitive function. Same thing here, looking at this slide. This one is for vegetables. So you see like the starchy vegetables, they're eating plenty of those, red and orange. Here you got your ketchup and carrots, and then you get your dark green leafy vegetables. Kids are eating a little bit more fruit. So here's the fruit intake going up. This is only up to 2010, but vegetable intake not going up. 85% of children don't get enough essential nutrients for optimal brain development. Anthocyanins, I picked this one out because it's such an easy thing to add into the diet and talk to patients about adding. You can obviously do, anthocyanins are going to be found in dark berries, so blueberries. A lot of times it's easy to get kids to eat blueberries. You do phytonutrient powders as well. So my kids have smoothies at breakfast time with their breakfast, and they have blueberries and raspberries in there, frozen. And so what we know about that is there are studies that have shown that the anthocyanins in blueberries actually can improve executive function, and they can improve even mood. So ruminating thoughts, I get a lot of patients, a tremendous amount in the last couple of years of teenage girls with anxiety and holding on to having this pattern of not being able to let go. So we always include phytonutrients and talk about eating berries, but also a lot of times doing phytonutrient powders. And that works on as an antioxidant, but it's also involved in the inflammatory cascade. Here's a study, small study done in children aged 7 to 10, double-blind crossover. They were taking blueberry drinks or placebo in the morning, and then they were measuring them on a bunch of different academic tests. And a couple of hours later, the kids with the blueberry drinks had improved test scores, verbal memory, response inhibition, their level of processing was improved, and it was consistent with the dose response, meaning that the kids were getting the 30-gram serving had better scores. So really, nutrition is a simple intervention. It really is. It doesn't have to be that complex. And I know it can seem overwhelming when you see all these terms coming at you, but it can be in a clinical setting, because I know that's what you're out there doing day to day. It can be very simplified. And we know it's not just nutrition. I know I told you my foundation is nutrition. Exercise and movement is important. So you can see test scores here going up based on the amount of fitness kids are getting. The other thing is that there was a nice study that came out in 2017 showing that babies who were held and cuddled, actually it impacted their genetic expression. There were epigenetic changes that were present years later. So it affects how we eat, how much we move, if we're loved. These are things that all affect our genetics. That picture's in the way. Another thing that actually says that kids, infants that ate more food prepared at home with high levels of fruits and vegetables from the time they were 6 to 12 months old, so that was just the study focus, had improved IQ by the time they were 4. So again, looking at that power of nutrient density. This was another study that was done in preterm infants, and they looked at how they were fed during the first 2 years of life, and there was actually an intervention arm in this study where they gave them a higher density, nutrient-dense diet, and the kids with the higher nutrient-dense diet, they looked at both groups, but the ones that between 7 and 8 years of age, when they revisited this and looked at IQ scores, they looked at a lot of different testing and found that it was much higher, significant changes with the babies that were supplemented with a high nutrient density. They even did MRI scans at 16 years of age and saw changes in the caudate section of the brain. Again, looking at that associated with improved IQ. Again, all going back to nutrition. I'm gonna give you a simple case I put in here. I know when I go to conferences, I always like to hear a case that often hits home. We all know that the rates of autism are increasing in the United States. I'm sure you have many patients in your practice that consult you about what can we do? Is there something you can do to help this child, a niece, a nephew? Is there something you can do? So here's a patient who came to see me, 29-month-old boy, and he had a recent diagnosis of mild autistic spectrum disorder, had a language delay. He also, these were not his main complaints, but of course during the course of history taking, he was constipated, bloated, he was having sleeping problems. His behavioral problems were more outbursts if he his rhythm was upset. So he was upset. So if his daily schedule was thrown off, he would have some significant upset. He was very reactive. There were siblings in the household, and it was becoming more and more difficult. He was not on any prescriptions or supplements. He was getting birth to 3 services. He was born at 36 weeks, had some feeding difficulties and reflux. He took an elemental formula, and then he also took a proton pump inhibitor, which is pretty standard of care in pediatric setting for kids with reflux. The only family history was that his father had depression and metabolic syndrome, and one of the young siblings had anxiety. So here's the breakfast. If you've had kids in your practice with autism, this might look familiar. I know this is a pattern that I typically see. And so you don't see, what do you not see? Not much phytonutrient density, right? And a lot of this becomes basically a conflict in the household. I can't get him to eat this, so he won't eat, so now I have to just give him this, or her. I did some assessments on this little boy, and I did a microbiome analysis, and of course found significant dysbiosis. So you can imagine, as you know, that the diet contributes to the gut bacteria. So if you're eating a diet like this, your gut bacteria is probably not going to be in balance, right? And very low levels of short-chain fatty acids, which is an indicator of poor microbiome status. The other thing I did, because I do a lot of genetics, is I did a genetic profile on him. The only thing that really showed up significant was the MTHFR. He had 2 heterozygous SNPs. I did blood testing as well, and he had a low B12 level, deficient level. So what we did for his intervention is not really that complex. So we did a gluten-free, dairy-free diet, and then talked to the family about how to incorporate more phytonutrients into the diet. I gave him a fish oil supplement, but we mixed it in blueberry juice in the morning, and he drank that. And so here we're using a juice, but it was high in anthocyanins. We were using a phytonutrient powder for this patient as well to try to get this concentrated extract into him while adding some vegetables and fruit to the diet. But to amplify the effect, using concentrated phytonutrients can make big changes more quickly. Also supplemented him with vitamin B12 and a methylfolate supplement, probiotics, and digestive enzymes to address gut health. The dietary component of that is also addressing gut health, so phytonutrients do impact the microbiome. At his 3-month follow-up, there had been significant improvements in his disruptive behavior in the household. His speech therapist had said he had the pattern of gains in his speech exceeded what she would have expected for the kids that she typically works with. His bowel movements were more regular as well, so he's going to the bathroom on a regular basis, and he actually was eating more variety of foods. So they did that method where you start to introduce it slowly over time, and that was working for them. I also measured his B12 levels at that point, and they had normalized, and his belly was no longer distended. So he actually was looking physically different in his abdomen. At a year out, that's when I did a microbiome profile, and his short-chain fatty acids had went almost close to normal range because they had been very low. And then his speech therapist noted him to only have a very mild delay that she almost wouldn't even classify him anymore, and then his sleep and behavior had continued to be improved. So think about that intervention. That's not that complex, and to have such an outcome, that's life-changing for that family. Most of what I did was nutrition, right? It was all nutrition-based, and most of the effect is coming from the phytonutrients in the diet, and not just single nutrients. I didn't just supplement him with a pill of curcumin. It was a full complex of phytonutrients, because we know that diversity matters, and diversity will affect the genetic expression, plant diversity, but it also affects the microbiome. So thinking back, you're going to work on the gut first, but you're also, when you're focused on the gut, you are also impacting human gene expression along with the gene expression of the microbiome. So the microbiome has more genes than our human genome. So when you impact the gut, this is why you can have such a profound effect on your overall health. And this concept of plant synergy has been around for a long time. So anyone who's spent a lot of time studying herbal medicine, the traditional herbalists talk about plant synergy. They mix herbs together, and they use herbal formulas, and this is why those herbal formulas work so well instead of always just giving individual plants. So the same thing happens same thing when we talk about herbs even in a dietary form. So that's another thing I also emphasize to patients, is adding herbs and spices to the diet. This is another way to get phytoactives in the diet, which is pretty easy. And again, just pointing out that antioxidant activity is really critical, but it's whole foods that make such a big difference, not those individual nutrients. And we see that in buckwheat extracts. We already heard about tomatoes being the same situation, where when you combine foods, you combine plants, herbs, and spices. Traditional cultures, when you look at cultures around the world and the way that they eat, they're using a lot of herbs and spices, and they're eating whole foods. They're not eating processed foods. So there have been, certainly you could go online, look in PubMed, and look at countless numbers of studies on the effect of diet on our gene expressions, that concept of epigenetics. If we look at a couple of really interesting examples, there was a study done in Spain a few years ago where they looked at chocolate. This was done in humans, so they were looking at the effect of chocolate on what's called global methylation status. So this is what you'll see when you look at some of these study findings, is they're talking about methylation of the genome. So this is epigenetics. So this is different than just the methylation cycle when you're talking about giving methylfolate and B12 and cofactors that affect the methylation cycle. When we're talking about patterns of methylation inside cells, it can vary from cell type to cell type. So some favorable patterns in most cells will be a hypomethylation, so an undermethylated state is associated with better health outcomes. In the case of chocolate, they did find that in the white blood cells, that was what they were measuring, that there was an improved pattern of hypomethylation. Now, for people who had MTHFR and MTRR SNPs in that study, the outcome was not as pronounced. So this is where you start to see, like, well, why is your patient not responding as well as someone else? This is where you see this genetic variability impacting that. Green tea also can have an effect on DNA methylation status, so it can undo hypermethylated runs of DNA, and that can affect, this is where you can see the effect in cancer. So you'll see many studies that show that green tea can be effective in controlling cancer cells, and that's because it can control the tumor suppressor genes. Coffee as well. Coffee has probably 1,000 different components in it. Two of the main ones are caffeic and chlorogenic acid, which you'll also see in other plant types. And that has also been shown to inhibit DNA methylation. Turmeric, probably all heard the turmeric story. You think about turmeric, you think about anti-inflammatory, but turmeric also is a potent hypomethylation agent. So that's working at the level of the DNA, and this is why you can see a cascade of effects when you have plants that all plants affect the DNA methylation, then all systems can be affected. This is a really interesting graph that was actually published in the New England Journal of Medicine. And what this shows is the correlation between per capita chocolate consumption and the number of Nobel laureates in the population. So I like this. So, like, look at this. We think about Switzerland, we think about chocolate, but look, Nobel Prize winners as well. And then where are we? We're down here. So we're not at the bottom. China's at the bottom, so they don't eat any chocolate. So maybe if they start eating chocolate, could end up here. That's all it takes, right? But that's really interesting. So, but we know that chocolate does affect cognitive function. And I don't know, this is kind of like a little bit of extrapolation, but I find it pretty amusing. And then, so I'm just going to point out, we were talking about plants affecting DNA methylation. There's a whole other, so you might not have a grasp on epigenetics at all. And now we're going to introduce, and that whole concept is Nutrigenomics, how plants can affect our genome. Now there's another concept you need to start to grab a hold of, because it's so much evolving science in this area, Nutrigenomics. And so this is the study of the influence of the diet. So again, what these plants are doing, but it's actually not on a DNA level. It's actually relating to compounds called microRNAs. So we produce microRNAs, and microRNAs have this effect on messenger RNA. So it most of them tend to silence genes, but there are some that upregulate genes. The ability for us to produce these microRNAs is, of course, influenced by our environment. And we're talking about diet and bioactive compounds, but it's also induced by stress. And back to epigenetics, stress and the production of cortisol does affect our DNA expression as well. So if we're under stress, so even though you might have your patient all set up, they're eating a healthy diet, things are good, they're exercising, but they have a lot of stress, they're not going to heal well. Because if you're not doing anything about stress, cortisol levels can be high, that's impacting genetic expression. So the same is actually true for microRNAs, and this is, this is starting to like open up wide in terms of the amount of evidence coming out on microRNAs and what may be, a piece of the puzzle that we don't fully have figured out yet. But there are even some tests that are, I don't think there's anything on the market yet, but there are studies showing microRNAs in saliva potentially being an assessment tool for stress too. So we produce these microRNAs, and bioactives like, all the key regulators we keep seeing over and over again for epigenetics, for inflammation, for oxidative stress. All of those also impact microRNAs too. So, of course, vitamins and minerals have been shown to do that as well. So these phytonutrients actually affect the microRNAs that relate to some of those key regulators. So the NRF2 pathway, cyclooxygenase also affecting that, and then BCL2. So this is where you see these components in the food, all of this merging together. And then the last key part of the microRNAs is there are microRNAs in our food also. So we're ingesting microRNAs. So that's another part. So we know about vitamins and minerals in food, fats in foods, the macronutrients. Then we talked about phytonutrients in food. There's also microRNAs in our food. MicroRNAs can survive digestion, so they can get through the stomach, found in the intestine. Plant and animal sources have different levels of bioavailability of microRNAs, but it seems like there's research so far is looking like that the microRNAs may not, these what we call exogenous microRNAs, don't end up in the bloodstream at very significant levels, but maybe they're having an effect in the gut. So that could be a potential mechanism. And then I'm just going to end off with a little bit of information about SNPs, oxidative stress, and inflammation. So SNPs are single nucleotide polymorphisms. So these are just one single change in a nucleotide in a run of DNA. And so MTHFR is probably the best well-known SNP, but there are also SNPs relating to inflammation and oxidative stress as well. So you can look at SNPs if you're thinking your patient is having major issues with inflammation or oxidative stress. You might want to look at their gene profile as well and start to look at whether they have issues with IL-6, NCF4, which impacts NADPH. Then you have this whole list of SNPs that you can actually look up, and you can look these up on a 23andMe, so you just need that RS number. And then the antioxidant pathways, these are some of the major players. These are not all of them, of course, but these are some of the major players in oxidative stress and in inflammation. And then you would know how much more intervention you have to do with that patient. So this is a topic that you could spend a week seminar on. I know there's a lot in here, but you really could spend a week on it. But I just wanted to introduce you, if you're not familiar with any of that information, to some of the big areas to be aware of that you're going to see. Why do these products work? You're hearing terms like NF-kappa B and NRF2 and microRNAs. It can seem like a big mess, but I'm just trying to get some of those key concepts kind of laid out for you. And then by the time we talk about this in a year, it'll be more stuff that you'll be like, oh my God, how much I just thought I had down that stuff. So I'm just going to end there, like this one. I'm a big avocado fan, so I find that really amusing. Thank you so much.